Good afternoon, everybody, and thank you for joining us for today's webinar, QPP Year 7, Tips for Successful Attestation Preparedness. Just a few housekeeping items before we get started here today. If you do have any questions during our time together, please go ahead and drop those in the Q&A section, and we'll be happy to answer those at the end of the presentation. We will be sending out some checklist documents as well that will go along with the slide deck shared today. I would like to also let everybody know that the information contained in this presentation is for general information purposes only and does not attempt to provide medical, mental health, or any other type of healthcare service. This presentation is not intended to be an alternative to medical treatment, and the content of this webinar may not apply directly to specific circumstances. This information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability with respect to content. Today's presenters are myself, Jared Deason, and I am joined by my fellow advisor and colleague, Tabitha Hanlon. So as we get into the topic for today, attestation preparedness, our agenda will include discussing how to find final eligibility and an overview of program requirements for 2023, as well as how to plan for attestation, checklists for each category, hardships and EUCs, and some resources that you may find useful when you're preparing to attest. And again, we will have some time at the end for questions, so please do drop those into the Q&A section if you have them. I will now pass it over to Tabitha, and she'll get us kicked off here with an overview of program requirements for 2023.
Thank you, Jared, for that introduction. All right, as Jared said, today we're going to be talking about attestation preparedness. And first, we're going to focus on an overview of 2023 requirements. All right, so this year we're in 2023 for the performance year, and the payment year is 2025 this year. The category weights across the 4 categories kind of remains the same from last year, as well as the reporting time frames. So for quality, you've got 30% as your category weight and 365 days for your reporting time frame. For promoting interoperability, you've got 25% for your category weight and 90 days for your reporting time frame. Improvement activities is at 15% for category weight and 90 days for reporting time frame. And for cost, we are at 30% for the category weight and 365 days for the reporting time frame. So the submission window for your 2023 attestation is going to be January the 2nd, 2024 through April the 1st of 2024. So that is important to note. Down at the bottom of your screen there, you can see the scoring thresholds for 2023. So if your final score ranges from 0 to 18.75 points, you would receive that full 9% negative payment adjustment. When you move up to the next category from 18.76 to 74.99 points, you would receive anywhere from a 0 to 9% penalty, depending on where you're going to fall within that scoring range. And then at 75 points is, of course, our threshold, and you would receive a neutral payment adjustment at 75 points. So if you score 75.01 points through 100 points for your attestation, you're going to get that positive payment adjustment. All right, so let's cover some basic information regarding those 4 performance categories. So on the left there, we're going to begin with quality. And for quality, you've got 6 measures that you're required to report for. And there's a few exceptions as far as the measures go. So the first is specialty measure sets that contain fewer than 6 quality measures. In these cases, you would report all of the measures within the measure set. The other exception is going to be MIPS value pathways, or MVPs. And for MVPs, you're only going to report 4 quality measures. That is required for your MVPs. So of the measures you report, at least one of those has to be an outcome measure or a high priority measure. And that's in the absence of an applicable outcome measure. There is also the CAPS for MIPS survey to consider. So if you choose to report for the CAPS for MIPS survey, that measure is only available to groups, virtual groups, and APM entities with 25 or more clinicians. There's an application deadline with the CAPS for MIPS survey to keep in mind as well, and I think that's already passed for this reporting period. But you can keep it in mind for next year. There are also 4 claims-based population health measures, and we won't go through those today, but I will mention that you could be scored on those if you meet the case minimums and clinician requirements for those. So if you are, then you would be scored in addition to the other quality measures that you submitted data for, which means that there's a chance that you could receive up to 40 additional points in the raw score for this category if you are scored on those population health measures. And one more thing to mention on the CAPS for MIPS survey is if you don't meet the minimum required for the CAPS for MIPS survey as far as number of surveys, you would not be scored on that measure. So you would want to make sure if you are using CAPS for MIPS as one of your measures, that you have another measure kind of hanging out there that you are ready to report for to replace for CAPS for MIPS as well. So next we'll move to the cost category, and your score is based on Medicare claims. The first measure on the list is Medicare spending per beneficiary, and with that measure, patients are attributed based on inpatient admissions. So that means any clinician who bills under the organization's tax ID number and billed at least one inpatient E&M service, that would attribute to the episode for that tax ID number. The next measure is total per capita cost, and this measure focuses more on primary care management. Then there are 23 other episode-based measures within the cost category that you could be scored for. So measure attribution for the cost category is determined by case minimums. One thing that's important to remember is if you don't meet case minimums for any of those 25 cost measures, then costs could be reweighted to another category, and that would affect your scoring on those other categories. So it's important to keep that in mind. Next, we're going to move to improvement activities. So your raw score for improvement activities is 40 points. That is reached through a combination of medium weighted and highly weighted activities. So 50% of your eligible clinicians have to participate in each IA that you submit, and you can receive full credit for 50% of your locations within that tax ID number if they are certified as a patient-centered medical home or a patient-centered specialty practice. And last, we have promoting interoperability. There are 100 raw points spread between 4 different objectives for this category. So first is e-prescribing, and then we have health information exchange, provider to patient exchange, and then public health and clinical data exchange. So scoring for this category is based on performance, with 5 bonus points available for those who can attest to participation and reporting for a public health registry, a clinical data registry, or syndromic surveillance reporting. And the last thing I wanted to mention is that you have to be operating within the 2015 edition Cures Update CERT functionality at the beginning of your reporting period, and you have to have the full certification by the end of your reporting period. So that is very important for this year. That won't only affect the PI category, it could also affect your quality category as well. So we want to make sure just to mention that. All right, so now let's move on to eligibility. So fortunately, eligibility requirements haven't changed too much over the past couple of program years. There are a few factors that are used to determine if you're eligible as a clinician under MIPS, and those are located kind of in the middle of the slide there. The first is that you are a MIPS eligible clinician type, and those are listed along the bottom of your screen there. The next is that you exceed all 3 low volume thresholds. Up in the green area for traditional MIPS, that is 90,000 in Part B billing, 200 Medicare patients, and 200 professional services, excuse me. And you also cannot be a qualifying participant or QP in an APM program. And the last, you have to be enrolled in Medicare before 2023. So as many of you know, there are two models for provider participation under the Quality Payment Program. And to be required to participate in MIPS, clinicians have to meet all three of those low volume thresholds like we just mentioned. We just covered the ones for MIPS, but I'll mention for the APM model real quick. So for the APM model, you have to be an advanced APM participant. You have to have 50% of your payments coming through Medicare, or 35% of your patient population as Medicare patients. All right, so now we're going to move on to 2023 final eligibility and submission methods determination. So when you're thinking about eligibility, there are a lot of things to consider. This slide has several things here that you can take into account when planning for attestation. So first in that list is, am I required to submit? Make sure that you're checking your eligibility and that you review that final determination at the end of the year. That's very important. Are there any special considerations or special statuses that would allow you to reweight in certain categories? And if you are able to reweight, is it actually going to benefit you to do so? So when considering your internal capabilities, you would look at things like, do I have access to run and view reports? Do I have more than one EHR? Do I need to aggregate my data because of that? Is your EHR capable of generating the types of reports that are required for submission? Or do you need to maybe employ a registry in order to submit for the program? If you're an APM member, are you familiar with the reporting requirements of the ACO that you're a part of? There have been many instances of providers that are a part of an ACO, and the individual responsible for taking care of the MIP submission isn't aware of that until they review the QPP portal. So communication is very important between providers and administrative staff that are taking care of these types of things. And last, EUC's exceptions and hardships. It's important to know what flexibilities exist around hardships, not only as an individual, but also as a group, and even at the individual measure level. Jared is going to kind of speak more about exceptions and hardships a little later during the presentation, so you'll get a little more information regarding those there. And lastly, what is your method of submission? Your submission method, is going to depend on things like whether you're participating as a group or whether you're participating as an individual, the size of your practice, what performance categories you're reporting for, and the capabilities of your EHR. All these things are going to carry weight as far as decision making regarding your 2023 attestation. All right, so now we're going to pivot a little bit and talk about final eligibility determination. So when determining your eligibility for the MIPS track, CMS looks at specific time periods, also known as determination periods or snapshots. And during these determination periods, CMS is looking at your Medicare Part B claims, your provider enrollment, and using those things to determine whether your organization and your clinicians fall within those low volume thresholds that determine the eligibility for the performance year. So the first snapshot for performance period 2023 took place from October the 1st of 2021 and ran through September the 30th of 2022. And that is considered your preliminary eligibility for MIPS. So right now, that final snapshot from October the 1st of 2022 through September the 30th of 2023 is what we're focused on right now. And that final determination should be released toward the end of the year. And that's going to be the final snapshot and the final say as to whether you are eligible to participate in MIPS, or whether you're required, I should say, to participate in MIPS. So let's move on to final eligibility determination and talk a little bit more about those different snapshot periods and kind of what they mean. So the screenshot above was taken from QPP.gov, and it kind of explains how CMS is using those two snapshots to determine whether you're exempt from reporting or you're required to report. So if you're below low volume thresholds for both segments, per the snapshot, you're MIPS exempt and not required to report. That also applies to only being above low volume threshold for one segment or the other. However, as you can see at the bottom of the graphic, if you are above low volume thresholds for both of those segments, you're going to be considered MIPS eligible and required to report for the program. So we do recommend that you are, if you're above low volume threshold for either one of those segments, that you be prepared to submit. And it's also important to note that that final determination is what ultimately decides your fate as far as having to report or not. So no matter what the segment, what segment 1 or segment 2 says, make sure that you're relying on that final determination regarding whether you're required to report or not. All right, so now let's move on to checking your participation status. So this slide shows how to check basic eligibility. And it can be done by going to the QPP website, and that is listed at the top of the slide there. You'll notice on their homepage that the box says check your participation status. And in this case here, you would simply type in the provider's MPI number and click check status. So once you search the MPI, you'll be able to see what practices that provider is associated with. And this is from PACOS information, and that's going to be submitted by whatever organization they are affiliated with. So if you had providers leave or you added new providers throughout the year, they may still be showing on here. It's not a real-time connection, and that can sometimes cause a little confusion. But to view that the more detailed eligibility, you would log in. And that's going to be done using your HARP credentials. So when you get to the main landing page, you would click on eligibility and reporting on the left-hand side of your screen. The practices that you're the security official for, or all of the practices that fall under the tax ID number that you're the security official for, will be listed there. So from there, you're going to click on view practice details and clinician eligibility. And you can then view the specific eligibility criteria for the organization. And the individual clinicians that have reassigned their Medicare billing rights to that tax ID number. So as you can see, under the practice name, their low volume threshold criteria are listed out there, as well as any special statuses that are assigned to the group as well. And then a little further down the screen there, you'll see that there is a section listed as connected clinicians. And if you scroll down, you can view the breakdown of each clinician that falls under that specific tax ID MPI combination. And it'll give you that detailed eligibility and the special statuses for those as well. And any accountable care organizations that clinician might belong to. And there at the very bottom of the screen, if you wanted to download that connected clinician list to kind of compare it to PACOS, you could do that by clicking there. I think it gives you the option to download it in a couple of different ways. All right, so we're going to move on from eligibility now and talk about participation levels. So you have a few different participation options. You can participate as an individual, as a group, a virtual group, or there's also options to report as a subgroup if you're reporting a MIPS value pathway. Advanced registration is required for that, so if you are reporting for an MVP, you would have to register for that prior in the performance year. And you can also participate via the APM performance pathway. So it lists here on the slide the different options that are available and what each is defined as. And you can see that reporting as an individual means that you're reporting as a single clinician identified by your individual MPI number. And that's going to be tied to a single tax ID where tax ID number, sorry, where benefits are assigned. That is what CMS identifies as an individual. And when participating as an individual, if you're eligible, you have to report. And reporting as an individual does allow you to choose those measures that you perform best in. So that is one of the advantages to reporting as an individual. Payment adjustments are going to be based on that final score for that individual clinician as well. So those participating as a group would have 2 or more clinicians or NPIs that have reassigned their Medicare billing rights to a single tax ID number. Most people, especially in larger organizations, are going to submit at the group level, and that would include all of the eligible clinicians that are tied to that tax ID. So those with group submissions would receive a score and a payment adjustment based on the group's final score. And if an eligible clinician also decided to submit as an individual, they would receive the higher of the 2 scores. Individual clinicians who aren't required to participate that, fall under that group submission, they would receive the group's payment adjustment. And on the third one there for virtual groups, this is a third reporting option that you have. And this is defined as 2 or more tax ID numbers that elect to form a group. So these can be non-affiliated organizations that have a collaborative relationship. Maybe they see a lot of the same patient population and kind of, refer back and forth. So it's beneficial for them to aggregate their data together and report as one entity. Or it could also be if you have multiple tax ID numbers that are under the same organization. And those can also form a virtual group as well. So these can be solo practitioners who are MIPS eligible, groups consisting of 10 or fewer clinicians that have at least 1 eligible clinician, and you have to have you could have a combination of both. So there is an election period that you have to submit your request during, and that does take place prior to the performance period. So that's something that you would want to keep in mind if you're interested in forming a virtual group, and make sure that you don't miss that election period. Some things to consider with virtual group reporting is, first and foremost, is that the clinicians in the virtual group always receive the virtual group's final score. So you remember I said, as far as group and individual participation levels, you can report as a group and as an individual, and you get the higher of whichever score that you use. That is not the case for virtual groups. You would receive that virtual group final score. So next, you would need to make sure that you're able to collect and submit data for all the clinicians within that virtual group. So you would want to make sure that you had things in place to be able to do that. And then you would have to aggregate the performance data for all the clinicians across all those categories. So these are all things to keep in mind with virtual group reporting. All right, so now let's move to quality submission and collection types. For the quality category, there are several collection types and ways to report and submit data. We're going to get into the first collection type, which is ECQM. So for this collection type, you're going to have functionality of the 2015 edition Cures Update criteria. We had mentioned that a little bit earlier, and I'm sure you'll hear it again before we get done today. And it's just because it's very important this year that you have that in place and the functionality is there. So if you're using more than one EHR, you would need the ability to aggregate data as well. Next are MIPS CQMs. These are often collected and submitted by a third-party intermediary. And that is an entity that they've been approved by CMS to submit data on your behalf. So you would need to use a qualified registry, QCDR, or other health IT vendor. So next, we'll move down to Qualified Clinical Data Registry. And these are going to be entities, again, that are approved by CMS. These are great options for specialty care, and you have to work with the QCDR to report. So for all of those different collection types, they're an available reporting option for all the participation levels. However, for claims, this is going to be a bit different. This is going to be for small practices only. These will be reported with the individual's MPI and group level data is only calculated if another category is submitted. And last, we have the CAPS for MIPS survey. So if you're participating in CAPS for MIPS, you would have to have registered between April 3rd and June 30th of this year. These are administered by CMS-approved survey vendors, and case minimums do apply, like we had mentioned earlier. So if you have this as a measure, you want to make sure that you report an additional quality measure just in case those case minimums aren't met. All right, so moving on to promoting interoperability. So for PI, there are going to be 3 ways to submit. You can sign in as a test. You or a third party can sign in and upload your submission, or a third party intermediary can perform a direct submission on your behalf via an API. So for submission requirements, you would need to use the 2015 edition Cures update to collect your data. And if you're using the last 90 days as your performance period, you would need to ensure functionality of the updated cert by October the 2nd, and that is coming up pretty quickly. So next, you need to submit data for all the required measures unless you have exclusions that you can claim for a minimum of a continuous 90-day period between January the 1st and December the 31st of 2023. You're going to submit yes to the actions to limit or restrict the compatibility or interoperability of CERT. You're going to attest yes to the security risk analysis attestation measure. You're going to submit yes to the ONC direct review attestation. For Safer Guide attestation, this year you're going to be allowed to still, or to say yes or no. It's not a requirement that you do it this year, but they just want you to specify whether you did or you did not. So if you leave that blank, it would result in a 0 score for the category. So you want to make sure that you answer that. And next, you would submit the level of active engagement for all the required public health and clinical data exchange measures. And provide EHR CMS certification ID from the Chapel site, or Certified Health IT product list. So one thing to keep in mind, if you're in an APM, when participating in MIPS at the APM entity level, APM entities can choose to report promoting interoperability data at the APM entity level. They still have the option to report for PI at the individual and group level, though. That's something to mention for this year. All right, so next we'll move on to improvement activities. There are also 3 ways to submit as well for improvement activities. You can sign in and attest. You or a third party can sign in and upload the submission, or again, a third party intermediary can do a direct submission on your behalf. So for improvement activities, it's not as in-depth as promoting interoperability, but for each of the improvement activities, those must have been implemented for a continuous 90-day period during the, implemented for a continuous 90-day during the performance year. And 50% of your eligible clinicians must have participated in the same activity. And then you must attest by submitting yes for each individual improvement activity as well. All right, so now we're going to switch gears a little bit and talk about planning for successful attestation. And first, we'll touch on planning and preparation for that. So these are some different areas that you kind of want to keep in mind throughout the year. So for the first 2 here, you're going to check these periodically throughout the whole year. For the QPP portal, you're going to make sure that your password is updated in the time intervals that are required. You're going to confirm that the security official in the QPP portal is going to be there during your MIPS attestation and submission period. And you also, it's a great idea to have a succession plan in place just in case, things happen and that somebody else can step in and take that over as well. You're going to reconcile the list of clinicians in the QPP portal. So reviewing those regularly and making sure that the eligible clinicians that should be attributed to your tax ID are in that list. And if there are some missing, that those are getting taken care of in the meantime. And also verifying that connectivity to all your associated practice tax ID numbers is taken care of as well. And then for PAYCOS, you're going to verify the contacts for PAYCOS access, make sure that the correct people are in there and that you have an assigned designee to maintain PAYCOS. And if, you know, like we mentioned earlier, if providers come into your organization or they, you know, change and transfer to another organization, you want to make sure that that connected clinician list in the QPP portal remains as current as you can keep it. So making sure that somebody keeps tabs on that throughout the year is really important. So these last two are going to be things that you're going to want to kind of check on during that final 90-day period. And for documents to retain, the advisors at the REC have put together a really great tool that you can use as you go through your attestation and submission for the 2023 performance period. And if you speak to your advisor, they would be happy to kind of go through this with you. It has a lot of great information as far as all of the documents that you need to retain for each of those different categories and the different measures within the categories. And it also, it's a great document to kind of pull everything together in one place. It has, you know, places to put where you're storing that information and who is responsible for it. So please talk to your REC advisor about that, and they can kind of show you kind of what that document contains and the benefits of keeping that from year to year. And last, we want to move to your chapel ID. So just make sure that all the components of your cert are combined when you're generating that cert ID. And that may be, you may need to pull in members of your IT staff or maybe your EHR vendor to kind of make sure that you're getting all those parts and pieces accounted for when you're building that cert ID. All right, so now vendor requirements. So there are some things to consider regarding your EHR vendor, as well as any like registries that you use and things like that. So we spoke a little bit about vendor capabilities in a previous slide. And some of the questions that might be important to get answered or, you know, if the vendor supports the measures that you want to choose, can they provide the type of reports that are required for submission and things like that. So I know many of us have dealt with EHRs that, you know, they kind of push the limits on time as far as updates and things like that. And it can affect how your EHR is pulling reports and kind of how you gauge your performance throughout the year. So it's important to make sure that you know how your vendors do business, confirm their processes, and make sure that they're going to line up with your own timeline as far as, you know, what you have planned and what you need to take care of throughout the year. So we also want to make sure that we know how the vendors are going to support you in the case of an audit. So as you know, CMS retains the right to audit for at least 6 years. So making sure that your vendor is going to, you know, be able to support you and what they will do and what they won't do in case of an audit, so you know where you stand as far as that goes. Unless you want to confirm that the vendor is going to assist in verifying data. If you're concerned about a specific metric and, you know, you want to make sure that they're going to be able to help you figure out what the solution is and make sure that your reports are as clean as possible and you know that your reports are correct, that you're using for your submission and your attestation. So during this process, you're going to, you know, check across all the quality improvement activity and promoting interoperability categories, and just making sure that your vendor is verified and that you have a detailed plan in place before that submission window opens. All right. So best practices and tips and tricks. So as far as attestation goes, you can start attestation in any category. You don't have to do it in any certain order or anything like that. But make sure that you're not submitting data for any category if you intend to claim a hardship for that category. And don't forget to confirm this with your EHR vendors as well if they submit on your behalf. You want to make sure that they're pulling out the things that they need to when it's time to submit. And also, just because you delete the file on your side doesn't mean that it's deleted on CMS's side. So that's something to keep in mind as well, and make sure that you're kind of communicating and being as clear as possible in that process. As far as documentation goes, always capture screenshots with the date and time stamp for preliminary score data. We suggest that all documents are saved electronically with an easy to recognize file name, and also that you print a hard copy of those documents as well. Keep them in a binder, in a space that, those that are responsible for making, doing your attestation and submission, that they know where that document is, and keeping it, like we said, for at least 6 years. So with that, I'm going to hand you guys over to my colleague, Jared, and he's going to cover the steps to plan for successful attestation, audit preparedness, and some reporting flexibilities around EUC exceptions and hardships.
Thank you, Tabitha. So as we're looking here at the quality category and begin to prepare to enter the last 90-day segment of the program year, there are definitely some key pieces you want to consider here to ensure that you have a successful attestation. Now is the time to really focus on improvement efforts around quality. I recommend by starting reviewing your reports for accuracy. Check your numerator and denominators for each measure. We'll just use tobacco screenings and cessation as an example here. Does it look like your denominator accurately represents your patient population? Maybe when you're reviewing the data, you're thinking that you possibly have more smokers, identified smokers in your population. Maybe take a look at the numerator and see if there's patients that have met the metric, what had they done to meet that metric. This can be a good indicator to take a deeper dive into the metric if things look off. Spend some time comparing your patient populations to the measure specification sheets. Review those workflows that are within your EHR system and take a look at those patient charts. Ensure that staff knows the workflows and correct places to document each metric. This could be a great opportunity for some quick education. If you plan on reporting as a group, ensure that all of your clinicians within the 10 are incorporated into the report. Be sure to review and use the MIPS gap that your advisor has provided you with and work to close those open care gaps. A good tip when you're looking at your measures is to focus on the ones that are at the higher end of those decile ranges and really try to work to gain an extra point or two. Another big consideration is to take a look and see if you can still generate your QRDA3 file. I'm sure it's been a while since some of us have checked. Does your vendor generate your file, or will you? Is your EHR certified to report individually, groups, or even both of them? If you can't answer these questions now, it's a good time to go ahead and start reaching out to your vendor, as that can take some time. When preparing to submit PI, there are definitely some things to consider. Ensure that all of your e-prescriptions for your Schedule 2, 3, and 4 drugs are being generated electronically. Querying the PDMP is not a bonus measure this year, so be sure that all CASPR queries are being integrated into the patient's record. Double check that your patient portal is functioning and that your staff is comfortable with providing education and driving utilization of the portal. This could be a great opportunity for some scripting to drive those numbers up. There are 3 options when it comes to the HIE measure this year. If you plan on using sending and receiving, be sure to review your numerators and denominators for accuracy and work to close those gaps on patients not meeting the measure. For bidirectional exchange, ensure that you're connectivity with a third-party exchange, and that it's integrated into your EHR system. If you plan to report with the TEFCA option, you must be connected to a national HIE or QHIN, and got to make sure that those bidirectional exchanges meet the ONC guidelines for participation in a framework agreement. Be sure to keep documentation for whichever option that you choose to use, and make sure that you have a plan on how you will submit your PI data. Is this something that your vendor is going to do for you? Is this something that you need to do? If you're planning to submit as a group, how will you aggregate that data for the eligible clinicians? This can be something that you will have to do manually if your EHR does not do that for you. Ensure that all your agreements are in place before the start of the 90-day period you're looking at selecting. And lastly, make sure that your SRA is done before the end of the year. So success with improvement activities is a little bit simpler than other categories, but there's still a few things you want to consider. First, make sure you are selecting measures and activities that are meaningful to your practice and the work that you provide. Ensure that your selected activities get you to the 40 points needed for a full score in this category. It can be between 1 to 4 activities to get you to those necessary points, depending on any special statuses CMS has granted and the weight of each activity. Make sure to check the data validation criteria and suggest the documents to retain for each improvement activity that you've chosen, and begin to gather your screenshots, reports, or any other documentation that's needed. If you are unsure about which documents you will need to retain, ask your advisor, and we would be happy to review that information with you. And lastly, remember that if you plan to submit as a group, 50% of those eligible clinicians in the group will need to attest to the same activity to receive credit. That activity does not need to be done within the same 90-day time frame. It just has to be the same activity. Cost can be a tricky one to plan for, as we're not actually submitting any data during the attestation window. Instead, this information has been collected throughout the year from our claims data submitted to CMS. But there are still some things that you can do to be better prepared. Review your historical cost feedback from program year 2022 is a good start. You can gain an insight on what you could possibly be evaluated on this year. Take a look at the cost measure information sheets and see what could be applicable to your practice. If a measure looks like it could be applied, go ahead and review those attribution methodologies and case minimums just to be as prepared as possible. I know that was kind of a lot there, and if you're feeling a bit overwhelmed, don't worry. As Tabitha has mentioned earlier, your advisors have been working on putting together some awesome checklists to really be as prepared as possible, and it takes each category step by step on things to consider, and it'll really help you be as prepared as possible come January 1st. If that's something that you're interested in, we will be sending that out at the end of this presentation along with the slide deck, and if you have any questions about it, please ask your advisor. Now let's take some time to take a look at audit preparedness. CMS does have the right to audit subsequent performance years for up to 6 years. In this next section, we're going to talk about some key components and documentation items that you'll want to make sure you have on hand in case CMS does come audit. When thinking about quality, there are some key pieces you want to make sure that you have saved in the event of an audit. Best practices are to keep all reports that you've generated throughout the performance year, but as a bottom line, keep a copy of the QRDA3 file that you plan on submitting. Once you have a list of all your MPIs and locations finalized, go ahead and put that in your files as well. It's a good idea to take a screenshot of your submission on the QPP site in case any issues come up later on. Once you have submitted the QPP to the QPP website, it'll give you a preliminary score. It's a good idea to hold on to that as well, so you have a general idea of what your score could be. Once scores have been posted by CMS, be sure to capture any feedback reports, data files, or payment adjustments for your records. For improvement activity, the biggest thing to make sure that you have in your audit documentation is that supporting information for each activity. Documentation can vary from activity to activity, so be sure to review the data validation criteria for your measures. Be sure that the timeframes are within these screenshots, reports, or training plans that you are saving for your documentation. Add a list of contributing MPIs for each activity if you're submitting as a group to show that at least 50% of the eligible clinicians did the same activity. And grab some screenshots of any preliminary scoring or anything like that once you've already submitted. When looking at promoting interoperability, make sure that you keep the PI report you're going to submit. Again, best practices is to keep all reports, but definitely keep the one that you are going to go ahead and submit. Make sure that your report has your selected 90 days on there as well and contributing MPIs. Be sure that you have all copies of your agreements for your HIE measures or public health reporting, documentation of your SRA, and if you're manually aggregating your data, keep those calculations as well. Make sure that you have your CERT ID and triple check that it's that 2015 Cures Act edition, so you do not get a 0 for the PI category. And as I've mentioned with the other categories, keep any preliminary scoring, EHR generated reports, and feedback reports. So we've talked about the things you need to save. And again, you need to save those for 6 years. CMS does reserve that right to come back and audit past performance years. When it comes to saving your information, we recommend that you save those both electronically and paper copies of them. Create a binder and label it with QPP and the program year on there. Save your electronic copies in the shared location so that others can access it if they were to need it. Keep both paper and electronic copies in safe locations as well. And as another little tip here, I would recommend adding in a transition plan into these files as well. In case there's any turnover or anything like that, scores will not be affected in the future. So let's change gears here and talk about some reporting flexibilities that are out there for 2023. We will start here with EUCs. An extreme and uncontrollable circumstance, or better known as EUC, is a rare event entirely outside of your control or the control of the facility. An EUC can be used in any of the following circumstances here. If you are unable to collect necessary information that is needed to submit for a performance category, if you are not able to submit information that is information that would be used to score a performance category for extended period of time, and or any situations that impact your normal processes affecting performance on cost measures and other administrative claim measures. The EUCs that were administered during COVID-19 pandemic are still available as well at the individual category level for this program year. When it comes to the eligibility for EUC applications, practically anyone that's participating in the QPP program is able to submit for an application. Individual eligible clinicians, groups, and virtual groups are all able to reweight any and all categories. The application period will open later this spring and will be available until January 2nd, 2024 at 8 p.m. If you do submit an application for an EUC, you'll be notified via email that your request was either approved or denied. And you can also check this under the eligibility profile within the QPP website. For those of you that participate in the APM tracks of the Quality Payment Program, EUCs look just a tad bit different. If you plan to take an EUC and reweight promoting interoperability, be sure that at least 75% of your eligible clinicians qualify for the reweight. APMs must request a reweight for all categories and not just individual categories. If you have applied and been approved for an EUC, any data that is submitted on the APM's behalf will not override performance category reweights. For eligible clinicians and groups that participate through the MIPS APM track, you can apply for reweights for any and all categories. If you participate at the APM entity level, you will receive an APM entity score, but that will be excluded from you will be excluded from the PI calculations. So looking here at automatic EUCs, CMS has the ability to apply an extreme and uncontrollable circumstance waiver to eligible clinicians that are located in designated regions that have been affected by a FEMA designated major disaster, such as flooding, fire, tornadoes, that we've seen here in Kentucky here recently. These types of EUCs do not need to be applied for. CMS will notify you if you fall into one of these regions. If an automatic EUC has been applied, all 4 MIPS categories will be reweighted to 0 unless data is submitted for 2 or more performance categories. These EUCs only apply to eligible clinicians and not to groups or virtual groups or APMs. And again, the COVID-19 waiver was automatic, but for 2022, it is now one you must apply for. So taking a look here at hardships, they're similar to EUCs, but usually tend to offer a little bit more flexibility. Hardships can be applied for if you are deemed a small practice by CMS, as well as some of the other special designations listed there in the blue box on the right. If your EHR system becomes decertified, if you have insufficient internet connectivity, and then extreme uncontrollable circumstances such as disasters, practice closures, severe financial distress, or vendor issues, or if you lack control over the availability of your cert. Eligible clinicians groups and virtual groups are able to apply for hardships, and those applications will open later this spring and be open until January 2nd, 2024 at 8 p.m. To apply, you would just log into the QPP portal using your HARP credentials and apply for those there. I do want to highlight the box here on the yellow as it is a staple to the PI category, and we've mentioned a couple times already. You will need that 2015 edition CURES update for your cert, or you will not be able to submit for the PI category. And this is not a reason to reweight PI. So we've talked about some EUCs and hardships. It's helpful to know where those categories would be reweighted to. This slide shows some common reweight scenarios that we've seen here at the REC. Do note that if you reweight 2 categories, it does not automatically mean each category will be weighted at 50%. QPP places a large emphasis on quality and cost, and if you plan on submitting one of those categories, it's likely that they will take the majority of the weight. If you are thinking about reweighting any category, be sure to talk with your advisor and to help understand how those can affect your final scores. I will now hand it back over to Ms. Tabitha, and she will talk about some helpful resources.
Thank you, Jared. All right. So some helpful links for information regarding attestation. So of course the QPP portal is going to be on there. That is the first link there. For HARP registration and profile information, we have the website listed there as well in the link. We also have the QPP participation status lookup, the Chapel website, and the Kentucky REC website there listed as well. So when we send out the presentation a little later in the week, this will all be included. And if you have questions about any other resources that you think would be useful, please speak with your REC advisor about that as well. All right, so now we'll move to questions. If there are any questions from anybody, you can put those in the Q&A box, and me and Jared will be happy to get those answered for you. I think we have a few in there right now. All right, so the first question is, how do I know what documentation to capture for improvement activities? So if you're submitting as a group, then you would need to determine which of the 50% of the providers that are going to capture that documentation. So you want to make sure that you know who those are first, and then use the data if I could say it, data validation criteria, excuse me, resources from the QPP website to provide CMS's suggested documentation that you would need to gather. Of course, like Jared mentioned, you would need to save that for at least 6 years. It's always good to have screenshots and things like that to show continuity over the course of the reporting period, from the start, in the middle of the year, and toward the end of the year. So just making sure that you have all of those things in place, and you could keep those screenshots in your electronic copy and then print those out and keep those in your paper copy as well. And the next question is, how do I look up my CERT ID? Jared, would you care to handle this one?
Absolutely. So you would navigate to the Chapel CHPL .healthit.gov, and I will be sure to drop that in the chat here. That's the website you will want to navigate to, and you'll start there in the search box by entering your EHR name, edition, or version. And then up in the top, there'll be a little yellow CERT ID button. You want to click on that. And scroll to the bottom and click on Get Your 2015 EHR Certification ID. You can print and save that from that screen there, and go ahead and place that in your MIPS 2023 audit file. Make sure that you do include all the modules you have though with your EHR system when you're building out your Chapel ID.
I can take the next one here, Jared. It says, what is the advantage to using a 90-day period versus a full year period for improvement activities and promoting interoperability? So there's a couple of advantages there. One is that there's more opportunity to perform better in a shorter amount of time. So it allows you to choose that 90-day period that you felt you performed the best in, versus, throughout the whole year. And then there's the second is going to be there's less documentation that you have to retain for that 90 days rather than keeping all of that for the whole year. So those are just a couple of advantages for that. All right. And I think we don't get any more questions submitted. This is the last question here, and I'll pass it to Jared. It says, what is the latest date that I can make my opt-in election?
Yeah, I'll take that one, Tab. Well, you should really determine which clinicians you want to opt in no later than the end of the performance year on December 31st. But you don't have to officially decide until you complete your MIPS attestation. There will be a toggle button in the QPP portal when you're attesting where you can choose in order to add the clinicians there. Keep in mind that the last date to submit is April 1st, 2024 for the 2023 performance period.
Okay. So if there are no more questions, we will move to our next slide here and talk about upcoming webinars. Okay, so in October, we're going to talk about interpreting your QPP feedback reports and understanding that beneficiary level data. That's going to be on October the 10th, and it's going to start at 12. That's going to be a client-only webinar. And then in November, we're going to have an educational highlights roundtable, and you'll get to listen to all the REC advisors together, kind of talk about that year-end review, and some of the things that we think are important as advisors to keep in mind. And that is going to be on 11/14 of 2023 from 12 to 1, and that's going to be open to the public. All right, guys, I want to say that we thank you so much for joining our webinar today. We appreciate you spending time with us, and be looking in your email in the next few days for the handouts that Jared was talking about, and also the slide deck that you viewed today during our presentation. Again, we thank you so much for joining us today, and have a great rest of your week.